How can I beat this injury? How can I overcome pain once and for all? And how can I beat the genetics that my family has given me because everyone else is going down the exact same path and I don't want to go there? Hi, I'm Dr. Nick. I own and run Functional Movement Therapy. I'm a doctor of physical therapy and back pain specialist who wants to help you with the most amazing treatment techniques that you can do from your own home to beat injury and become and stay pain-free and healthy. I'm going to give you my 7 best secrets to stay pain-free, overcome injury, and live a happy and whole, full life so that you can enjoy the things that matter most to you and not worry about rehabbing all the time or taking pills or supplements or whatever your doctor prescribes going through the next shot, surgery, or medication. Let's jump into it. This is the exact framework that I use in my program, the FMT 360 method, where we actually guide patients to overcome injury from the comfort of their own home. These are the checkpoints that I use as I see clients from all over the world who struggle with injury and just understanding their injury. We have a totally new and really holistic approach to battling pain, battling dysfunction, and I want to share it with you today because it's important. More importantly, it works. And so if you stay by these principles and use them to their fullest potential, you guys can overcome amazing things and use your bodies as the wonderful tool that it is that helps you to stay pain-free because we're using our body as they were meant to be used. And I teach on principle because once you understand the problem and you apply the principle, well, you can do that in a variety of ways and you don't have to be limited to stretching every day or, as I mentioned, taking supplements every single day of your life, or really just trying to overcome or mask that injury. You can actually be pain-free and be fixed. You can fix yourself because we were all put together grandly in this beautiful design and we were all meant to heal. So let's jump right in, guys. I want to give you my first principle, which is that posture tells a story. Posture tells the story of how you address gravity and how you align yourself to beat the forces of gravity and to beat the forces that are put onto you externally by the world. Now, how many of us have poor posture? Go ahead and raise your hand. Right. I'm still waiting for Mama to be wrong. She just was right. We've got to stand upright. We got to stand, keep our eyes up, keep our chin up, keep our chest up. But there are extremes of posture. Some slouch, some throw ourselves into military grade awareness all the time, and neither one is right because, guys, posture is fluid. That's right. We are meant to move and move with posture, but align ourselves through what I call lines of symmetry. So nose, chin, sternum, belly button, seam of the pants, and ears, shoulders, hips, ankle bone. Those should all be aligned really well as we move through 3 dimensions. Okay. Now it's so vital, and so many of us get this wrong, where chin leads or shoulders round, or we just get, again, if we go into too excessive of posture, we lose that symmetry. And that can immediately throw us off, causing tension, aches, soreness. And when those symptoms start to present themselves, most people either A, ignore them, or B, try to cover it up with the quickest thing that they know how to do. Could be a cream, could be a potion, could be a stretch, could be a straight up ignore. And my friends, I want you to be aware. Be aware, be curious, and now we can start to have something new in the toolbox to use to combat that pain. Proper posture should be feet about equal, 4 to 6 inches of space in between those feet for most normal height people, right? Weight in between your hips and heels, loading the hips and heels with knees unlocked, glutes behind our heels, right? Shoulders down and relaxed, eyes up and forward and chin parallel to the floor. And if we align that properly, we should find quads, glutes, and deep core muscle across the abdomen. This is called your transverse abdominis, very, very important muscle. We should find that those muscles come on lightly. And if you're not sure where those muscles are or how to activate them consciously, by all means, shoot me a comment below and let's get you that information so you can be successful here. Because this is principle number 1 for a reason. It's one of the most important aspects of health and wellness. Number 2 principle is that we want to find stability through muscles, not joints. For instance, many people lock out the knees, and we do this out of comfort. It's what I find. Comfort A, habit number 2. But when we lock out those knees, what it does to our posture, we lock out our knees here. We throw our knees back. Watch what happens to my pelvis. It goes into what's called an anterior pelvic tilt. The pelvis tilts forward. The lower back curve increases, thereby placing more strain on the lower back immediately. Now, this is not something that you'll see in an MRI scan or that your neurologist will likely notice because it's a functional movement, standing posture. And neurologists and orthopedics love to diagnose via images and not seeing the person across the room. So I'm glad you're here today to get these golden nuggets that can just take away bits and pieces of pain as we chip away at these problems using principles, now we know, to find stability through muscles and not joints. And the muscles that we want to find initially are called the triangles of stability. The triangle in geometry is the most stable shape, and there are triangles throughout the body, both vertically and horizontally. So we want to learn how to utilize these muscles properly in function and have full control, really, so that we can use them appropriately. And that's where we start our training. It really all does start with the feet. We notice that if the feet pronate, so if the feet cave inward, and you'll notice if the middle of your foot, right in the center where your arch should be, if that's caving inward and touching the floor, you pronate. If you supinate, then you're rolling outside of the foot, and most of your weight will be on the lateral aspects of that foot and heel. If you pronate, the heel rolls inwards. If you supinate, the heel rolls outwards. And you might also find a presentation at the hips and knees that correlates with this foot presentation. When the foot hits the floor, it affects every other joint moving upwards. And so whether you're a pronator or supinator, either aspect can be detrimental to your seeking ideal posture. And we really want to make sure that we can find, here's this triangle idea, the ball of the foot, the outside of the fifth metatarsal, the outside of the fifth baby toe, the center of the heel, down flat when you're placing that foot on the floor with, again, your weight through your hips and your heels. I say, well, Nick, I've always stood this way, or I've always done this. And, this doesn't feel right to me. It feels weird to unlock my knees. That's great, my friend, because when we start to notice that things feel different, our outcome changes. And I take it that you're here for a reason, that we want to change something. We want our outcome to be fundamentally different. So weird is great. I want you guys to run towards weird. And as we use our body different, it's going to feel different. But none of it should hurt, okay? If you do have pain with any of these changes, by all means, please reach out, because I want to know, and we want to see where you're going wrong and what can be tweaked. Most often, it's just a little tweak that you need to be able to get over that hump and use that principle to its full effect. Number 3 principle here is the breath. Breath is another vital aspect of function. Obviously, all of us know that without breathing, we can't sustain life. But most of us breathe through our bellies. Let me ask you a question. How can you contract your core if you're breathing through your belly the whole time? Interesting, yes? Now, our lungs, I think we all know, are right up here in the rib cage, right by the heart, right? Those vital organs protected by the rib cage. Our lungs are up here. We breathe down here. Many of us do. Interesting. How can we contract our core? Why aren't we breathing from our lungs? Doesn't make much sense, does it? So, for your awareness, some of the anatomy here, we have our lungs, we have our diaphragm that's right at the base of the sternum, right at the base of our breastbone here. We have our transverse abdominis that comes around the abdomen, the only muscle that attaches to the spine to contract and stabilize that spine on both sides. And then we have the pelvic floor. So here and here. And this works like a piston. As you increase the oxygen in your lungs, right? We take a breath in, our diaphragm lowers. And at the same time, our pelvic floor lowers. And as we exhale, our lungs compress, the ribs compress, the diaphragm rises, our pelvic floor rises, thereby creating that piston-like system so that we always have a stable amount of pressure in the abdomen. And I call this positive pressure, right? It doesn't change or fluctuate, so thereby we can create some stability. However, a dysfunctional breathing pattern, one of many dysfunctional breathing patterns, because there are a lot, that too much to go over in totality in this course, but for the most part, I see belly breath being one of the most detrimental, especially when we're talking about back pain and a lack of core stability, a lack of core stiffness. You can't contract the core if you're constantly breathing from your abdomen. That means that you really can't maintain that core for a prolonged amount of time. Most people in function need more endurance than actual strength, right? We're not picking up 500-pound weights. We're doing the dishes or yard work or gardening or taking care of the kids, which absolutely is an endurance type of activity, right? Because those kids go. The weeds of the garden just keep on popping up. We need endurance for those activities. Therefore, we need to be able to maintain this muscle for quite a long period of time. So how can we do that if we don't breathe while we're stiffening that core, right? To engage that core properly, we want to draw that belly button in lightly. We're thinking about a wide abdomen here. And then you have two bones right here, right by the pelvis here. And up and in about 2 inches, we should be able to lightly press out as we are able to maintain breath. We'll relax the inner thighs, we'll relax the glutes, we'll relax that pelvic floor. See if we can start to feel that timing. And if you have a problem learning and feeling where that pelvic floor is or what it does, I highly suggest you do this lying down on your back with your knees bent. You might even need to touch right in between the genitals and give yourself a cough to let yourself know where it is. Little, kind of like you're at the doctor. You'll feel that pelvic floor drop and pulse, then you know where you're supposed to be feeling. And as you inhale, letting those glutes go, letting those inner thigh muscles go, and allowing that pelvic floor to fall is most important. Now, many people, one of the biggest misconceptions that people have about the pelvic floor is that we're always supposed to strengthen. Strengthen. Misconception. You cannot strengthen a short and tight muscle. So if we have not been using our diaphragm, we have also synonymously not been using our pelvic floor, right? They're not moving together and probably not moving at all. So the most important aspect of pelvic floor health is actually to lengthen that pelvic floor. Actually, as you breathe in, letting it fall and seeing almost if you can get a stretch reflex at the very bottom before then you exhale and bring that pelvic floor back up, which would then, that voluntary contraction would then be called the Kegel as we bring the pelvic floor up, which is what holds your intestines and your bladder. Once we have our core stability, then we need to move forward with our skeletal system before our muscular system. This is principle number 4. If you have full range of motion of your skeletal system, of your spine, of your shoulders, of your hips, of your knees, then likely you will have a significantly less amount of tension in your muscles. That only goes to make sense, right? If my shoulder moves through full range and I can get all the way up here, even behind myself, wrap around, get that shoulder back. If it moves fully and freely, then yes, these muscles work with me and they're working well and they're already stretched out. So I don't have a feeling of tightness because that skeletal system is already moving well. For most people, especially those who are moving up in age, and all of us want to be healthy well into age. My goal is to live to 100 or more and continue to be athletic and mobile and independent. I also want to keep my joints happy and healthy. Now, not only does that immediately change and help the soft tissue tension that might be building up in otherwise stiff joints, but it also keeps the joint healthy because it lubricates the entire joint by moving through full range of motion. So we all have what's called synovial fluid within our joints. This amazing fluid that helps to keep our articular cartilage very, very happy, very, very healthy. You think about an engine that doesn't get oil to a certain part of the engine. Say it got oil to most of the engine, but not the complete part of the engine, this little part over here. What would happen to that part of the engine? It would get hot, it would get some buildup, and it would start to break down, right? And it would get some rust because it doesn't have oil to that part. And you start to get that heat build up and crank, 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 crank. You all can imagine what's happening there. The exact same thing is happening to your joints when you don't take your joints through full motion. And so we have to know what the three planes of motion are. Sagittal plane is forward, backwards. Sideways plane, called the frontal plane, is side bending or abduction and adduction coming across that body in here. And then we have rotational training as well. And our ball and socket joints really, really need that rotational training through all ranges and all planes. Our hips need that, right? And our thoracic spine needs that terribly. And many people break down here, my friends. And so this is a way that we can preemptively fight arthritis. Yes, arthritis does not have to be a death sentence. Just because your mother and father have it, just because some people get it earlier than later, or you've been diagnosed with a degenerative joint or degenerative disc disease, many times we have lost motion in those spinal segments or joints of the body. So spending time on the skeleton makes sense. Many doctors don't seem to get this, but the first thing we do is an x-ray to diagnose those things, and yet we're not suggested mobility. We're suggested anti-inflammatories. We're suggested more pharmaceuticals, right? And it just makes sense to start to mobilize and self-mobilize, and you can do this from the comfort of your own home as you work through this process. And this will help not only the pain, but that chronic tightness, that tension, that deep ache that we really, start to throw heat on all the time or ice packs on all the time. Why don't we treat it with movement? Because, my friends, movement is medicine, or one of my other favorites, motion is lotion. So let's start to think about these problems in a different manner. As we do get to the muscular system, principle number 5, muscles may not fire without intention. If you have been using your body a certain way, it is used to being used that way. So our bodies, just as humans, human nature, we are all going to look for the path of least resistance. We just do. I do, you do. We all want to work smarter, not harder. And we all can get a bit lazy, right? So I brush my teeth the same way. You probably do as well. Your body is going to be used to working in a certain way. So when we start to find that, hey, maybe these triangles of stability muscles aren't firing properly, maybe I have chronic muscles that work too much. So I have muscles that work too little, I have muscles that work too much. There's a dysfunction there. I need to teach these guys to pick up their slack and do what they're supposed to do. We need to be intentional about that. And that's where a guided program can really be beneficial, can really help you to overcome years of pain and dysfunction that maybe stretching or chronic chiropractic care or you name it. A lot of things can be overcome. So let's learn what the triangles of stability are, learn how to activate those muscles both independently. And then one of the most important things about functional movement therapy, one of the differences is we relate our activities to function. Always. It's never do this because I said so. It's always a do this because it's going to affect this, which is going to lead to this, which is going to do this, and this is how you're supposed to feel it. That makes sense. Cool. I can jump on board with that. And now I am a part of that treatment. Now we're a team instead of you just telling me what to do. That's never really worked for me. We talked about intentionally training those muscles of the triangles of stability first. And then we will extrapolate that and start to incorporate those into our functional movement patterns. So there are 7 functional movement patterns. We have squatting, deadlifting, lunging, split stance deadlift, single leg RDL, or what I call a golfer's pickup, and pushing, pulling motions as well. We can also add throwing into that as an essential functional movement, which is really important for us to be able to do. If you can do all that, 95, if not more, % of life will be handled well, and you'll be using your body as it was intended to be used, and thereby not breaking it down and living a more long and healthy life. And so we really want to make sure that we're walking well through full range of motion with proper stability, utilizing our muscles and our core stability as we breathe. See how everything comes together. And that is part of the beauty of the FMT 360 method, is that we don't waste any effort. We get you right to the things that matter most. If you can stand up well and have good posture, if you can walk well, if you can feel your muscles and have full range of motion and engage them in actual life, we're moving forward, aren't we? And that's what I want for you. That's absolutely what I want for you. I want you to be happy and healthy and well. And I hope that these points are hitting home. If so, be sure to share this course with your friends or tag a friend who could use this information to move forward from pain, injury, and mobility, whatever they might be overcoming. I'm also going to add the link to my back pain Facebook group down in the description below, so that anybody struggling with back pain, sciatica, disc herniation, or other can join and absolutely just get more support. All right. So as we start to come to a close, I want to leave you guys with another couple gems that will push you over the edge here. First, I find that balance is one of the most underrated aspects of fitness. It is. It truly is. And if you find yourself walking, but with your eyes down consistently, or just feel unsteady and you need to be touching things as you move around and you just feel better with your hands on items, that's a key that balance is needed to be addressed. And the last thing I want to give you is to be sure to work all 3 planes of motion. That's with both range of motion and mobility activities and your functional movement training, because we move in life in 3 dimensions. So as we progress load and progress your strength, we want to get off the machines. Machines are a great place for a quick workout and to do a little something and to move a little bit of weight, but they have you sitting the entire time. And when you're gardening or playing with the kiddos or doing anything meaningful, you're probably not sitting, right? We're moving in 3 dimensions. We're rotating, we're twisting, we're bending, we're hinging. We're doing these things, and we need to recreate those activities in your workouts so that life becomes easier. Yes, it's for weight loss. Yes, it's for endorphins. Yes, we're moving because we want to be healthy. But also, if we're training with intention, we're training to make life easier, and that will prolong our health. So you guys, move intentionally, move well. And if you need anything, please feel free to reach out. I'm going to drop a link to schedule a consultation below if you need further advice and consultation on how to start to set up your wellness program or to how to overcome injury and pain based on the FMT 360 method. I'm Dr. Nick. It's been a pleasure serving you guys, and I wish you all the very best.